Alaikum, I'm Dr. Tahira and you're watching PTV's program Health is Wealth. Today we're with a dentist. And why are we with a dentist? Because our smile is one of the most important parts of our personality, the first thing that anybody notices about us. We have one set of teeth, we need to look good in it and we have to use it to eat as well. That is why watch in detail our program today with Dr. Munaf. Assalamu alaikum, welcome to another episode of Health is Wealth. An elephant has two sets of teeth, one that they can flaunt and one that they eat with. But unfortunately, we have just one, which we have to flaunt as well with our $1 million smile, and we use it to eat as well. So we thought, why not another episode on dental hygiene, dental health, and all that you need to know about teeth and the oral cavity. We have with us today Dr. Munaf, who's a dental surgeon. Thank you so much for joining us today.
Thank you for coming over.
So let us talk about teeth and the oral cavity in general. So first, let's talk about dental hygiene, which is absolutely missing in our society because people think it's not at all important to take care of our teeth. So how important is dental hygiene and what do we do about it?
Dental hygiene is as important as you taking a bath. You have to be continuously very adamant on this fact that you will follow a routine. Twice a day dental cleaning is actually
mandatory.
It saves you from a lot of systemic problems. Right. Pakistan has the hygiene issues only because of this reason, that we keep on emphasizing on this fact that if we get dental hygiene work done, our teeth are going to get ruined or they're going to get grinded or something.
Right.
That is one of the reasons why most of the people really don't come to us. This is a myth. Oral hygiene is mandatory. It has been related to a lot of systemic problems like heart problems, blood pressure, diabetes, preterm low birth weight babies, and now they're relating it to Alzheimer's.
Exactly.
So yes, hygiene is mandatory. It is the entry of all bacteria inside your system. So it needs to be a clean place. If it is not clean, you will definitely get sick.
So when we speak of hygiene, visiting a dentist is of course on the charts, but what about daily hygiene? How do we maintain good dental hygiene? Like, do we brush our teeth? Do we floss our teeth? Do we use a mouthwash? What is an ideal dental hygiene routine at home?
The best and the foremost is brushing twice a day, once in the morning and before you go to sleep. And, which are mostly people don't do, floss.
Right.
Flossing is mandatory.
After each meal?
After each meal. And not each meal, once a day. And if once a day flossing is actually considered good enough to maintain the interocclusal tooth health so that you do not have proximal caries.
So what do we use as floss? People tend to use like toothpaste
simple floss.
Or simple floss.
Simple
you don't
floss.
Use the toothpaste.
Just go to the market, get Oral-B, any brand, big brand which you have, get the floss which is gloss so that it actually smooths, it's smooth and it can actually go between the teeth, and it's very easy.
And what about mouthwashes? Do we use mouthwash or do we not? Because there's a lot of controversy regarding mouthwash that it actually erodes the surface of teeth.
I believe that mouthwashes should not be used.
Should not be used?
No, not at all. The best and the foremost, the most beautiful mouthwash would be
saline water?
Yes. Salt water, you take lukewarm salt water and do as much rinsing as you can. It is the best for gum health and it maintains your recession. It actually reduces the recession of the gums because of periodontal problems.
And what is an ideal brush? How often do you change it? How should the bristles be? And what is the difference between a toothbrush for a child and an adult?
Now, you have to understand that in Pakistan, the toothbrush never retires.
Yeah.
So it actually starts off with your oral hygiene, then actually moves further.
Yeah.
And then you're cleaning things with it. End of the day, you're putting... it's used for multiple things.
It for your trousers as well.
Exactly. So, so we utilize it for multiple reasons. But we need to retire from the toothbrush from oral health after 2 to 3 months.
2 to 3 months.
90 days is the maximum time you should use a brush, and after that you should change it.
So when we talk about brushes, what kind of brush is the best for us? Like something with a soft brush, soft bristle, or a hard bristle, or the ones with the electronic ones, or there are ultrasonic ones as well now. So what kind of brushes do you advise to our people out there?
Now, among all the toothbrushes which you have in the market, it does not matter you're using a mechanical toothbrush, you're using a mechanical or manual one. The most important thing is the type of the bristle which is being used.
Okay.
So the type of the bristle needs to be soft.
Okay.
No matter if it is mechanical or it is manual, you will use only a soft bristled brush and you will change it after every 90 days.
And do we change it after, for example, a throat illness? Like often people do not change their brush once they have a throat illness or they have a strep throat, for instance.
You need to.
So please, do tell our audience that.
You need to change the toothbrush after throat infection because your bristles are the most beautiful place for the bacteria to harbor.
Yeah, to thrive
They
there.
will colonize there, they will grow there, and you will keep on using it, thus actually introducing the
Reinfecting
bacteria
yourself.
again and again into the
And what
your oral
about
hygiene.
toothpaste? Because there's so many fancy toothpaste in the market and people keep marketing different kind of things like fluoride infused or something or the other. So what toothpaste do we look for and what is the ideal ingredient in a toothpaste?
That is actually the second question. The first question is which toothpaste to use.
Right.
Fluoride, non-fluoride, that's separate.
Okay.
For most of Pakistanis don't even know that there is a strip underneath the toothpaste which defines the toxicity level, or would you say
Really?
the amount of chemicals
That red,
in that
blue,
toothpaste.
green strip?
Yes,
So what
the
does it
red,
stand for?
blue,
Black?
green and black.
Black.
Most of Pakistanis using black, which is toxic for human health.
Why would they even make something that's toxic?
That's something where we're not going to go.
It doesn't make
Because
sense,
the
right?
big
Why would
farm.
they make- Okay.
So what you have to understand is
Yeah.
that Colgate, which is the cheapest, is all synthetic. It has a black strip underneath, and it is actually toxic for human health.
Oh.
So, and the red one is synthetic but with medication. Blue
Okay.
one is herbal with medication,
Okay.
and green is full herbal.
So we should use
So-
green or blue.
You should always use green or blue.
Oh my God.
So
See,
that
no,
is
none of-
something which you're not supposed to.
Yeah, I think
Now
nobody
we talk
even
about-
knows about that.
Now we talk about the fluoride.
Right.
Excessive fluoride is extremely bad for the human health as well.
Okay.
Use of excessive fluoride would actually it scleroses the pineal gland, and actually they say it has more repercussions if you use excessive fluoride in your diet.
Okay.
But yes, it is good for the teeth, no doubt it is. But I personally believe that excess of anything is bad, so we should not
So
really
a lot
use
of
excessive
chemicals
fluoride.
for the tooth are not advised,
No,
right?
no, not at
so
all.
when we speak about visiting a dentist or a dental hygienist for cleaning, how often does that have to happen and what does a dental cleaning at a dentist's place mean? At a dentist's
So-
office when you go for cleaning, what do they really do?
So when you come to us or you go to any dental surgeon, the first thing is that we will check the oral hygiene of the patient. Scaling and polishing is mandatory. Oral hygiene is compromised mostly in most of the population of
Right.
Pakistan. So our first advice would be to get proper hygiene done, prophylaxis or scaling and polishing done, which is actually repeated after every 8 months.
Okay.
Now, people say that that's a short time span, but it is not. 8 months is the minimum time span which you should have. After that, you should get your scalings done. Your teeth do not get destroyed by it. We use diamond dusted burrs to actually cut the teeth. And for scaling, we just use a tip which is resonating. It's a stainless steel tip.
You know,
so it cannot damage
But
the
the
teeth.
reason why people don't visit the dentist is you're so expensive.
Yeah,
Why are
that is-
dentists so expensive and there's diamond and gold and all of that? We don't have enough to
You have to
sustain
understand
ourselves
dentistry.
right now. Yeah.
Ek to number one, dentistry is expensive because the materials are expensive. Now, if you want longevity in your treatment, you have to have good materials.
Okay.
If you don't have good materials, you will have to repeat the treatment. The filling will keep on coming off. You'll have issues with the treatment.
Okay.
So that's number one. Number
Okay.
two, we import everything. We don't make stuff.
Yeah.
Pakistan is actually not famous for making anything much. So, having said that,
Right. So this
So-
diamond
so-
dusting and the scaling and polishing, a lot
Yeah.
of people complain that once they've had this, they start getting teeth sensitivity, they can't stand the cold or sweet, and then they also say that their shine has somehow eroded off the tooth.
No, that's also a
myth
myth. You have
again?
to yes, exactly.
Okay.
But you have to understand that you spent 22, 23 years of your life without going to a dentist.
Right.
So you have a lot of plaque accumulant in your mouth,
Right.
which is continuously depositing there and disturbing your gums.
Right.
Now, initially when the plaque deposits on your teeth, it is actually if this is the tooth and this is where the gum starts, so it will be at the exact margin.
Okay.
Now, it's acidic in nature. So the acidity touches the gums really don't like it. So the gums tend to swell up.
Okay.
Now, when the gums swell up, we see the bleeding and we're like, yeah, what's going on? So we start using different kind of toothpaste, do salt water rinses and stuff, but we're not removing the plaque from the tooth.
Exactly.
After some time, because the irritation is constant, so what happens is that the gums really don't like it. So the
Yeah.
gums start going down.
Okay,
Well,
so
as
they
soon
got
as
regressing from your
that's
place?
called the receding gums, or masude niche or
Yeah,
the gums
so they
going
come,
down. Yes.
yeah.
So, so when the gums go down, there's more space for the calculus to deposit. So
Okay.
the deposit actually starts to increase.
So it's a vicious circle.
Now,
Yeah.
a time comes when you start having pain. You're like, that this is not right. I'm not really comfortable
Right.
with this. And what's going on? I need to go to the dentist. So you come to us. We see that there's a lot of calculus. So we tell you that you need scaling impulsion. The moment we remove the calculus, which is now acting as an insulation to the
So you start feeling
area,
it more.
yeah,
Yeah.
that area which was supposed to be inside the bone, or which was covered by the gum, now is exposed inside the mouth
Right.
because you're delayed.
Yeah.
So eventually what will happen is that the moment we remove the calculus, you will have sensitivity in your teeth.
But it
But
fixes
it will
itself?
go away,
Okay.
definitely, of
So you
course.
spoke about calculus and plaque, but what about like debris that's left in the mouth and then bleeding gums, because of which you start having halitosis or bad breath? A lot
Yeah.
of us have bad breath and we don't realize it, and then people don't even understand what could be the reason for that bad breath, and then they have bleeding gums every morning when they are trying to rinse their mouth. They see that there's a lot of bleeding from the gums, which
Yeah.
causes more and more bad breath. So what do people do regarding this bad
Come
breath?
to the dentist. So, but the thing
Yeah.
is, the bad smell in the mouth is because it's called halitosis.
Right.
And so that's because of the decomposition of the blood by
Okay.
the saliva.
Okay.
Now, saliva actually would digest anything which comes in its mouth because it has
Yeah.
digestive bacteria in
Right.
it. So when the blood is digested, the smell of the blood is what causes halitosis.
Okay.
So if you want to actually get better from it, go to the dentist, get your cleaning done, get your other things checked because
A
it
vitamin
can be
C deficiency
No,
or
no.
something?
Vitamin C deficiency is also there, yes.
Yeah.
And it can cause ulcers. It will make. It can actually cause more gum problem, of
Right.
course. But the basic concept which I have actually come across in the past 22 years is that the gum disease is the only reason or main reason for bad breath.
Oh, okay.
Yes, but then again, pericoronitis, which is the infection of the wisdom tooth, or pus formation because of any kind of endodontic problems can actually cause the same problem.
How bad are habits like smoking and the use of betel nut and all sorts of tobacco? And recently there are a lot of newer forms of tobacco pouches that people are, using very
Yeah.
rampantly around here as vogue or style for that
Yeah.
matter. So how bad are those things for the tooth?
Smoking, every kind of betel nut,
Pan and all of that,
the new
yeah.
packs which have come in, the nicotine
Yeah,
packs
exactly.
and everything which have come in, all of them are damaging to the gum, oral
Right.
oral hygiene
Okay.
and oral health. When you place a nicotine pouch, the area where you place it, the nicotine is so
Toxic.
It is so toxic that it tends to ulcerate there.
Right.
That's why the people who keep pouches keep on keeping the pouch at the same place
Yeah,
because
then
of
they
the
have-
ulceration. There is more absorption there.
Right.
That's the same thing with tobacco. The tobacco chewers do the exact
Yeah.
same thing. And that is one of the reasons that because of the constant irritation, that area doesn't heal up
Cancerous and it becomes
turns to
cancerous.
cancer.
Right.
Most of the cancers, oral cancers, are because of chewing tobacco.
Right.
Cigarette smoking is extremely bad. It actually causes the same kind of effects. Cigarette smoking, on the other hand, has another factor which actually comes in, which is the tar.
Yeah.
So the tar tends to actually stick onto the teeth surfaces, and
Right.
it actually makes them all black with bad
Yeah.
shading and everything with it.
So how bad is the gum? There are a lot of gums in the market that are being advertised as good for the gums or good for the teeth, and they say, chew on this gum and it's going to make your teeth stronger or
No,
cleaner. How
chewing
good is
gum
that?
is actually
Yeah.
chewing gum or it was considered as very significant for oral hygiene because it makes you salivate, it makes you rotate,
Okay.
it makes you actually, and the gum keeps on touching everywhere, so it does tend to enhance
Okay.
oral hygiene. But it's just maintenance.
Okay.
It cannot be a treatment. It is something which you can do
Okay.
to keep yourself fresh, but it cannot be the main way of having
So
oral
how
hygiene.
bad are sweets for the teeth? For example,
Extremely.
they keep saying that don't have sweets, and if you sleep with after eating sweets, or if, for example, children, they take a lot of candy and then they have
Oh, yes.
a lot of cavities
Even
in their
milk.
mouth.
You have
Milk
to
and-
understand that
yeah.
everything which goes into the mouth is digested by the bacteria in your saliva.
Right.
Now, when it is digested, whatever it is, will be acidic in nature.
Right.
Now, if you're having toffees and sweets, they stick to your teeth. Now, that will decompose there. The bacteria will, as soon as the pH changes to acidic, that starts to destroy and
Okay.
demineralize the tooth structure.
Okay.
Now, when the tooth structure demineralizes, that's when we see the black dot right there.
Right.
कि कीड़ा,
Yeah. Yeah.
as if there's an insect sitting over there, but that's not the insect. That's
Right.
basically the demineralized tooth structure, which is decaying because of the acidic medium, which is
Okay.
produced by
So
the
when,
bacteria.
when we speak about acidic medium, so these fizzy drinks, they're
Oh,
supposed to have a lot
carbonated
of
drinks are a
phosphoric acid and
disaster.
all of those.
Are a disaster,
What about this
complete.
tartaric acid that we have in these savory dishes of ours, or pickles and all of that? Is that good for the teeth or bad for it?
Really bad, because
Okay.
you have to understand that all carbonated drinks, tartaric acid, and all the tartar sauces
Yeah,
and
exactly.
the spices which we have, they're all extremely bad for the teeth.
So what is good
But-
for the teeth? What is an ideal diet for the teeth? Calcium, like what?
Once the tooth is made, calcium won't actually have any effect.
Oh,
So the
okay.
when the tooth formation is complete, no matter if you have calcium deficiency, it will not affect the tooth structure.
So what is good for the teeth? Like biting onto
Ha-
whole fruits
chewing
and
stuff,
nuts?
chewing stuff,
Okay.
meat.
Meat?
Yeah, it's very good if you can keep the oral hygiene.
Okay.
ठीक है, so the problem with meat is
That it
because
gets
when you're
stuck in
chewing,
the middle.
हाँ.
Yeah.
So if you're flossing and if you're keeping it clean,
Yeah.
teeth, you have to understand the dynamics of the tooth structure. So the tooth structure is basically made to make sure that the food you eat is grinded well
Right.
and can be digested by the
Yeah.
GIT or the
Yeah.
the
So
whole
we're carnivores
gastrointestinal
by
tract.
our makeup, right?
Sorry?
We're like as humans, we're carnivores, right?
Yeah, we are
So
carnivores.
So we're designed
So
to
the more we
eat.
use the
Yeah.
teeth, the more healthier they'll get.
Okay.
Now, if you see the more raw things which we,
Yeah.
like more organic things we have,
The better
when we
it is.
move towards complex carbohydrates and
Or
synthetic
processed
foods,
diet, yeah.
that is something which is destroying our teeth more than our normal diet would.
Right.
Natural fruits, foods are excellent.
Okay.
But again, teeth will only remain healthy if you keep them clean.
Right.
There's no exercise which can actually keep your teeth healthy.
So there's nothing that you can actually do other than just cleaning your tooth
Yes.
or teeth for oral hygiene. What
For
about
oral
cleaning the tongue? And for
Oh,
example,
that is something
and
which none of us
Yes,
do.
and what do you
Most of the
use
people
for a
don't.
tongue? What do you use for the tongue? And also, when you're a child, if you have a child, how do you clean their gums after they've had their milk, after you've fed them? Children who have not yet have teeth, like they don't have
Okay.
a full set of teeth yet.
Okay. So as far as tongue is concerned, tongue has very small finger-like projections all over, which
Okay.
are not, which can actually have bacterial colonization right between
right
them.
between them.
That's why when we wake up in the morning,
It's
mostly
white.
we would, if you,
It's white,
it's
yeah.
slightly in the white
Yeah.
tone and everything. So you need to actually use tongue scrapers
Okay.
to actually clean the tongue. Most of the people don't clean their tongue. That is also one of the reasons for halitosis as well. Thank
Right,
you, thank you for
yes.
bringing this up,
Yeah.
because that bacterial colonization will not go away till the point you don't clean it.
Exactly.
And besides tongue scrapers, if you don't have it, you can just use a brush. It
Right.
might cause you a gag reflex, but cleaning the tongue is mandatory. It needs
Okay.
to be done.
Okay.
As far as kids are concerned who have no teeth
Hmm.
and are having milk, so you don't need to do much
Rinse
because
their mouth.
you can if you want, but after milk, if there are no teeth, nothing will go bad. So the
Okay.
gum is actually very accustomed to it, so it's perfectly fine. But yes, if you have teeth, then you really need to make sure that you either make them rinse their mouth, or best preferred would be brush their teeth before they go to sleep.
Okay, so one of the most common dental concerns is toothache, and when they present to you with a toothache, it's usually because of an inflamed gum or a
Yeah.
cavity or some kind of infestation, I don't know, some kind of insect inside or whatever they call it, right?
Yeah.
So how do you deal with cavities, number one? What are the different options of filling a cavity, and what exactly is a root canal, and how does it relieve you of the pain?
So, if you have pain in a tooth, can be because of multiple reasons. It can be because of gum swelling. It can be because of your periodontal ligaments are inflamed because of constant food being impacted between
Yeah.
the teeth. Now, if your tooth it has a cavity in it, and you have pain, then that can be because the cavity has extended to the nerve supply of the
Okay.
tooth. So if the cavity has extended to the nerve supply, then you definitely need a root canal. Otherwise, you can actually fill it up with different filling materials like composites and GICs, and we have multiple filling materials which we
Okay.
can use to fill the tooth, which actually behave exactly like the tooth structure. They might
Right.
not be as strong as the tooth structure which God gave, but it compensates well.
Okay.
So that is something which we use for filling. But when you start having pain and your cavity has reached your nerve supply, then root canal is the only option. Now, what is a root canal? So what we do is that we open up the tooth from the top, clean the tooth up from the inside, and make sure that we reach this nerve supply.
Okay.
We remove the nerve supply, fill the canals up with a gutta percha filling material, and make the tooth dead. Now, what our basic job is to make sure that we desensitize the tooth. What makes the tooth sensitive is the nerve supply. So if the nerve supply and the blood supply is gone, the tooth would be viable to use. But yes, when we take the nerve supply out, the tooth is dead. A dead tooth is a brittle tooth.
Okay, so
you need to crown it. So if you don't crown it, it will fall off or it will break off.
So what exactly is crowning and bridging and all of these things? Because before implants, we used to hear these words a lot. But now we have a lot of things called implants, and we don't need dentures anymore. And they say, you know, this is the great breakthrough in dental medicine, and it's expensive, but it's more longer lasting and easier and more convenient.
Yeah, actually, when we talk about they are all restorations, right? So the restorations would be such that we are compensating for the loss of tooth structure. Okay. So when we give a crown, so that crown would actually compensate for the loss of the tooth structure which was there, which was eaten up by the cavity. In the same way, now you have a tooth which had to be extracted, so it's a missing space. It's a missing tooth. So you have two teeth on the side. So you grind both teeth on the side to join them together and give one tooth in the middle suspended with the support of the teeth on the side. That's a bridge.
Right.
And there's another thing called the dentures, in which we actually just place the tooth in. You can take it off at night, which most of the people are familiar with, and you can wear it to actually use it for mastication. But implants, now implants are also old technology.
Really?
Now
They're
there's
obsolete now?
No, not obsolete.
What do we have after implants?
So now we have tooth budding, which is actually...
so you're making a tooth grow?
Yeah, so that's the new research which is coming in.
So what do you use, like stem cells or something to make them grow?
You're harvesting tooth buds and
that's
actually
really nice.
placing them into the bone and letting it
They
grow.
do grow and regenerate.
The research is going on. So it is. It will take time for it to actually perfect the function of it.
And is this possible in like geriatric patients? Because mostly it's the older lot that suffers from a lot of tooth decay and tooth loss and everything, and they're the ones who have to use dentures, and then it's very hard for them because their structure isn't even strong enough to support them. So implants were good for them, but can diabetics, people with severe diabetes, go for implants?
Oh, yes.
They can?
Yes. You have to understand that the only difference between a diabetic and a normal person is the delay in healing.
Okay.
So placing implants in a diabetic person is not a problem. Maintaining the diabetes while the healing process is taking place is something which has to be considered. Now, if a person is maintaining his sugar levels and has a surgery, he would recover well. Now, in a normal person, we would give around 8 weeks for the implant to heal and so that we can give the tooth over the top. In a diabetic person, we will make it 12. So that's the only difference there is. There is no contraindication of implants in diabetics or any other problem besides one thing, that the patient has to take responsibility of the treatment. Now, you get an implant, it's perfectly fine. 7 days down the line, you start eating sweets again.
Oh, so
and you are actually not maintaining. So what happens with diabetes is that it tends to make your immune system go low.
Exactly.
So if your immune system is not there to fight any source of infection, you will definitely get an infection. So you're more prone to infection. So you don't want to put yourself there or compromise yourself or your health process so that you can actually get.
So what about the wisdom tooth? Why does wisdom come so late, number one? And why does it give you such a hard time?
Now, there are a number of theories behind the wisdom tooth. Some say it's evolution. Some say that now we were carnivores. We were bigger in size as human beings in older times, or Stone Ages, which they say. So there are a number of stories why the wisdom tooth is there, but it is a supplementary tooth. Now it will only give you trouble when there is no space in your jaw for it to grow.
And it needs to grow to its full potential? Does it push all the others?
No, that's not possible.
Okay.
That's a selling point for a lot of doctors to actually take it
So
out.
does it have its own space?
Even if it doesn't have a space, if it is stuck even, there are two far more stronger teeth in front of it,
Okay.
which we use as anchorage to move the rest of the teeth in orthodontic treatments.
Okay.
So how can one tooth move the rest of the teeth? It's not possible at all. But yes, it's a good selling point. You can convince a person if you don't get
But
this
why does
removed.
it bother people? Why does a wisdom tooth start bothering people? And when does it bother people?
Now, for example, if the teeth are supposed to come out straight,
Yeah.
right? So if there's a tooth which is placed at an angle to the first one, that is number 7, or the second molar, and now it's coming out at an angle, and there's a space between the teeth, you cannot clean that space. So when you
Okay.
can't clean
So-
that space, that will
okay.
create infection around
Around it.
Thus, it will make the gum actually grow.
Inflamed
It is more prone to infection.
Right.
So, considering these elements, if the tooth is malaligned, or it is at an angle, or if it is placed in a way that would cause problem to number 7, which is a second molar you eat with, it is a functional tooth.
Okay.
So it is preferred to remove it. Now, yes, removing it is difficult.
Right.
Your face does swell up for 5 days. You need antibiotics, and you need to be very careful in post-operative care. You're not allowed to spit because spitting is there because
Right.
blood keeps on coming for 72 hours.
Right.
So those things need to be taken care of. Wisdom teeth are difficult teeth. I wouldn't say they're easy,
That's why not everybody is wise.
no,
So not
rightly
everybody,
said.
not everybody can take wisdom this way,
Yeah.
right? So
Or
let's talk
you
about
comfortable
dentition
with it.
now. How bad is a pacifier for children? How do you make sure that they have the best teether or something that aligns their teeth properly? And if their teeth are not aligned and they have those bunny teeth and everything, how good are braces for them? And then we'll come to the veneers later. Let's talk
lovely.
about
So now, as
alignment
far as
first.
orthodontics is concerned,
Yeah.
pacifiers are concerned. Pacifiers of every kind are bad because not only the fact that they fall down, children pick it up, they introduce more bacteria, causing gastrointestinal problems, but also that because of continuous sucking, it actually takes the palate up, so it
right.
makes a vault really high. So high vaults tend to actually they pronounce the facial
Speech,
features,
okay.
and they change the facial features as
Alright.
well. They change the speech as well. They tend to actually have more
swallowing
nasal
reflex as
smell
well.
as
Okay,
voice as well,
Okay.
when it comes to when they're growing up.
Yeah.
But now the orthodontic pacifiers are pretty okay if you can actually keep them clean, so the kids can use them because kids are very prone to using pacifiers. But then again, it's a habit which should
So
not be
breastfeeding
there.
is always better than bottle feeding, and obviously
Breastfeeding is definitely better than bottle feeding. Then again, you can never compare the two milks.
Okay.
But then again, whatever the reason,
If some child is suffering from some sort of like DNS, deviated nasal septum, or some kind of blockage in their nose because of which they keep their mouth open and they breathe with their mouth, does it also affect their dentition in some way?
it actually tends to introduce. It makes the teeth more carious. Actually,
Okay.
if you're a mouth breather, you're more prone to have more calculus. You're more prone to have more caries. You're more prone to have more halitosis,
Okay.
which is bad
Yeah.
breath. So yes, that's not the right thing. So you need to actually even if you have DNS, get it corrected.
Get it corrected.
Mouth breathers have a lot of dental hygiene issues, and also because of excessive air intakes and
Right.
everything. So you have salivary stones, and you have multiple
and
issues.
what
which
about
can
what about children with tonsillitis and adenoids and all of that? Does it also affect like this recurrent infection? Does it have an effect on the oral
that's
hygiene?
more ENT related.
Yes,
but
it is,
yes,
but does it affect the teeth? That's what I'm asking.
if you have tonsillitis,
Yeah.
you will have bacterial colonization.
Okay.
But that bacteria is very different from the
So
bacteria
it's
which
not
will
going to
actually
affect your teeth?
It won't affect your teeth, but definitely will affect your oral hygiene.
Okay.
Definitely, of
What
course.
about braces? What's the right age to get braces?
Coming back to that,
Yeah.
yes. So pacifiers is something which should not be used. Okay. As far as braces is concerned, braces is the best time for braces is going to be from 11 years to 14 years of time, depending upon the case. Genetics are a lot involved in malocclusion of teeth. So
Right.
if the parents have malaligned teeth, there's a big possibility kids will have
They'll have
malaligned
crooked
teeth as
teeth as
well.
well. Okay.
So you know, it's
they're getting it from their
genetic.
mom or
So you
dad.
got to check this first.
Okay.
to
So what is
14
the
years of
perfect
age.
Hollywood smile? Everybody nowadays are flaunting it and just are making fortunes out of it, buying bikes from
Veneers
it.
and crowns.
So what is this about this new set of teeth that look the same? and
So-
are really white and shiny.
That's cosmetics.
Yeah.
Now you have to understand that vanity is insanity.
Yes, it is.
And there is no stopping it.
Okay.
You can keep working on it. There is no limit to it. If you want to remove the deformities and if you want to make perfection,
corrective one is always fine.
you can give veneers and crowns, but it is damaging to the teeth. We do grind the tooth structure,
Yeah.
and that's a permanent damage. You have to live with it.
Right.
Even though that there are more pros than cons of actually giving
Yeah.
veneers and crowns, but even then it is something which should be advised to the patient and told about before we do it, so that the
Right.
patient is in consent that yes, the teeth will be grinded in veneers and crowns.
Thank you so much, Dr. Munaf, for joining us today. And we heard from Dr. Munaf what ethical practices and how you need to choose the right dentist for your teeth. And now we'll be moving inside and going to our procedure room where we can discuss more about the procedure options that we have available. So we're here with Dr. Munaf in his dentistry room, the room that scares all of you, and we're going to listen to how we are supposed to brush our teeth so that they don't fall out this way on this little model over here, and he's going to explain all about the dentist chair as well as all his instruments. So here, Dr. Munaf, can you please explain how you're supposed to be brushing your teeth?
Thank you so much. As far as the brushing is concerned, we'll just get to it. But let me first explain you about the dental chair and everything, and how things are divided, and there's nothing to really fear with the dental chair.
Okay.
So we have the scaler, which is used for scaling and polishing. Okay. So this is something which is for your prophylaxis and cleaning of your gums. Then you have the polisher, which polishes your teeth after your scaling, and scaling without polishing is no scaling at all. So this is mandatory. Then you have a handpiece, which is air turbine. So we use compressors to actually use the handpiece. So it revolves at around 80,000 revolutions a second. It's a very fast machine, but it's very effective, and it is totally painless.
Okay.
And then we have the water jet. So this we call it the triple syringe. So we have the water, the air, and all of this to actually clean any kind of residue which is on the mouth.
So is that the same as the suction?
No. This would be to
Just
throw the water.
okay.
So suction and the other things are on the other side.
All right, okay.
So this is our control panel in which we can actually move the chair in any position we want.
Okay.
We can actually take it up according to whatever the position the patient or the doctor is comfortable with. Then we have the exam sets, which are the basic sets which we use.
Right.
I'll just open one right now.
So sterilization is very important,
Oh,
right?
mandatory.
Because
So this is a sterile pouch, right?
Right.
So it has all indicators on it that
Right.
whether the cycle was complete or not. So these indicators define that these instruments are clean and they can be used.
So you sterilize them in an autoclave?
Autoclave, and only a B series autoclave.
Okay.
So that's the optimal
that's the gold
sterilization for
standard
dentistry.
place.
So when we open it up, now the sterilization is gone. So
gone.
now we are specifically supposed to use it for the patient.
Right.
So we have a mirror, a probe,
Right.
and a tweezer. So these are the three basic elements which we use in examination of the patient. So this will show us the places which we can't see. Probe will be to actually see if any kind of cavity which is there has any catch point, thus showing us that if there's any demineralization on the tooth, and probe is just to pick stuff.
Okay.
So these are the three basic.
And what are
things.
those little screws out there?
Coming towards this side, so the handpiece has these diamond dusted burrs.
Okay.
So these burrs are used to cut the tooth structure. So we have different shapes and sizes.
So it's like diamond cut diamonds. So
diamond cut diamond,
okay.
exactly. So these are the things which we use to shape the tooth, clean the tooth from the inside, any decayed tooth structure, or drill hole when we require. So that's for this. These are the polishing burrs. Once the cut is there, you should polish the cut so that it looks
Okay, and so
pretty.
do you have to do you match these colors according to a chart or something when people are here, when you bleach them and you polish them?
We have shade guides and everything.
Okay.
I'll tell the staff to actually show you the shade guides as well. So we use the shade guides for restorations like crowns and bridges. We match the shade in daylight, of course, and then order the lab to actually make it according to whatever shade which we choose.
And what are the materials that you use for filling, if you could just give a brief overview?
So, like I said before, that we have composites, we have GICs, we have different kinds of cements, zinc phosphate, zinc oxide, eugenol, depending upon where to use and how to use it.
Okay.
So that depends upon the damage of the tooth. And
Right.
according to that, we have to choose which one would be the best to give the functionality to that tooth.
Okay.
Now, as far as coming back to the oral hygiene part.
Right, yes.
So now, if this is your, I'm sorry, one of the tooth is missing.
Yeah,
so
they didn't have
this
good oral
patient
hygiene.
actually already lost a tooth.
Yes.
So, so always, it's the repetition which will clean the teeth.
Okay.
It is not the force.
Okay.
Most of the people actually, when they're brushing
grind
their
it,
teeth,
yeah.
they're making sure that they're rubbing the teeth
No,
like anything
yeah.
with the brush, which actually destroys the toothbrush
Okay.
and the tooth
And the
itself.
tooth as well.
Yes.
Yeah.
So it's the repetition. So
Okay.
20 strokes per tooth surface is the basic criteria.
Oh, that's a very long time.
Yeah, actually, it takes around 1.5 to 2 minutes to actually properly brush your
Okay.
teeth. We spend hardly 30 seconds on it.
Exactly.
So every surface of the tooth,
Right.
be it inside or out, or the occlusal surface, needs 20 strokes. So
Okay.
when you start off, if you do it quadrant-wise, that
Right.
would actually be better for you, so that you can keep a check where you actually did the brush and where you did not do it.
Okay.
So you start from the left or the right, but continue throughout and make sure that every place or every portion of the tooth is touched
So
with
it's
the brush
upwards
for
and
20 times.
downwards? The
That
movement?
actually does
That
not
doesn't
really
matter?
matter. So you can actually keep on, you can do up and down,
Right.
you can do
Sideways.
horizontally. It does.
Yeah.
It really doesn't matter. What matters is that the force which you apply needs to be consistent and less,
Okay.
and it needs to be 20 strokes.
And you need to keep rinsing in the
And
middle.
of course,
Yeah.
whenever you want, it depends upon the amount of saliva, your salivation. So if you have more salivation, you will be definitely spitting more. But if you have less, that you will
All
be
right.
spitting less.
And-
But so 20 strokes, and then the tongue and the palate. Now,
Right.
the palate actually mostly rinses itself when you're actually when you're gargling or you're spitting. But then again, if you can use saltwater rinses after brushes, that is beautiful.
Okay.
So that's something which you need to do. Now, I really can show you the movement, but
I think that's good enough. Thank you so much, Dr. Munaf, for joining us today. We had Dr. Munaf with us, and as you heard him explain to you that you're going to be taking complete 2 minutes to brush your teeth from now on. Twice a day you'll be brushing your teeth, and it's not the force that you apply, but the direction and the consistency with which you're going to be brushing your teeth that's important. Also, you're going to be flossing your teeth from now on and visiting a dentist, and he's assured us he's not going to be very expensive with you, so you can be getting your scaling, your polishing, as well as any sort of tooth ailment that's bothering you fixed right in time, because a tooth in time is going to save all the 9. So keep watching us, and inshallah we'll be meeting next week. Allah Hafiz.